Depo-Provera, a popular contraceptive shot that's given many of women, including myself, peace of mind for over 3 decades. But now, new lawsuits claim that it may carry unexpected risks that could impact our health. Hello, and welcome back to Chambers of Knowledge. So today we're going to be talking about the recent Depo-Provera lawsuits that claim the birth control shot is linked to serious brain health risks. Whether you've used Depo-Provera yourself or you know someone who has, it's important to know what's going on in the world of women's health. Depo-Provera is an injectable form of birth control made by Pfizer. It contains a synthetic hormone called medroxyprogesterone acetate, which prevents pregnancy by stopping ovulation and thickening cervical mucus to keep sperm from reaching an egg. It's taken every 3 months, and when used as directed, it's about 99% effective in preventing pregnancy. But here's where things get concerning. Recent studies, including a large study published in the British Medical Journal, have found that women who use Depo-Provera for extended periods of time face a significantly higher risk of developing a brain tumor called a meningioma. A meningioma is a tumor that develops in the meninges, the protective layers around the brain and spinal cord. While most meningiomas are benign, meaning they're non-cancerous, they can still grow large enough to put pressure on the brain and spinal cord, leading to symptoms including headaches, vision changes, and seizures. Meningiomas are usually slow growing, and in some cases they only need to be monitored rather than treated. For those who have severe symptoms, or for those 2% of cases that actually have cancerous meningiomas, treatments often include surgery, radiation therapy, or a combination of both to control growth and relieve symptoms. In response to the claims of these lawsuits, Pfizer has updated Depo-Provera labels in Europe, adding a warning about meningiomas. However, in the United States, there is no such warning, sparking frustration and concern among us users and medical professionals alike. So many women in the U.S. are filing lawsuits against Pfizer, claiming the company failed to disclose these risks early on. If you're watching this video and you're wondering, are you at risk? Here are some things to consider. Studies suggest that the risk of meningioma increases with long-term use, meaning those of us who have been on Depo-Provera for more than a year are at higher risk. Now, with all of this information, you might be asking, should I stop using Depo-Provera? Because that was my exact reaction. Now, this is a highly personal decision, and I'm not going to tell you what decision to make. This is something you should discuss with your healthcare provider. They're very familiar with your medical history, the things that you're prone to, the things you're more susceptible to, and how long you've been on the shot for. What symptoms should I look out for? If you use Depo-Provera, keep an eye out for persistent headaches, vision changes, and memory issues.